Hello everyone. We at NSS RVCE had started this awareness campaign about COVID-19. And in this regard, we have now started interviewing some of our frontline workers who are striving day and night to protect us from this pandemic. So today we have Dr. Basvaraj with us, who works at the district hospital in Ramnagar. Thank you so much, ma'am, for taking out time from a busy schedule to help us for this noble cause. So I'll just start with the questions now. So there are many queries related to the vaccination and things like that. So the first question is, what is the difference between all these vaccines? And is there any vaccine that is better than the others?
Actually, presently in India, there are two vaccines, that is Covishield and Covaxin. There is not much difference between those two vaccines. Both are equally safe to take. Efficacy-wise, both are equally efficient. Okay. And me as a COVID warrior, I was given Covishield only.
Okay. So there's no much difference. We can have any vaccine. So now, what are the precautions we should take after we get vaccinated?
After taking a vaccine, especially after the first dose, so many, stop following the protocol, what they used to follow previously, like could be social distancing or masking or sanitizing. They try to, after getting vaccinated, they think they are completely protected. It takes about 2 to 3 weeks for the antibodies to develop. And only after the second booster dose, the full immunity would have come in, the antibodies would have been formed in our body. So you will have to take precautions, and precautions as you were taking before the vaccination, and you should continue to take even after the 2 doses of vaccination. The same protocol should be followed, like social distancing, masking and sanitizing your hands. Now that, it's already 3 to 4 months since we have been vaccinated, that we are following all the protocol what we used to follow before, like during the beginning of the pandemic, that was in the last year.
Yes.
So please continue to follow the same precautions. Do not neglect. That's what is happening. That is why so many people are getting infected.
Yeah, that's right, ma'am. So is there a possibility, can a person be affected by COVID even after 2 doses of vaccination?
There are cases I have seen in my own hospital. I can say a few of the doctors and my staff nurses and attenders getting infected after the complete, both the doses were given, they have been infected with COVID. But it was a milder form when compared to people not vaccinated with any of the vaccine, whether it be Covishield or Covaxin, the protection is better when you're vaccinated. Okay. And if you get it also, it will be of a milder form.
Okay. So ma'am, are there any side effects? How long do the side effects remain in the body after getting vaccinated?
Yeah, usually once they administer the dose or the particular dose, you will be kept under observation for up to half an hour. That is the time when any reaction to the drug happens. So it could be some anaphylactic reaction or anything that can take place happens within that half an hour. Afterwards, usually the side effects could be like when you take any vaccine, there could be some small side effects like fever, myalgia, that is body ache, and the pain at the injection site wherever you have taken injection, some vomiting sensation, headache. Although all those could be there, and that will be subsiding after 1 or 2 days.
Okay, so these side effects are pretty normal, nothing to worry much about, right?
Accordingly, whatever symptoms you have to take drugs accordingly. Like simple paracetamol would help you.
Okay, ma'am.
Myalgia and fever also.
Okay. If a person has recovered from COVID and he had taken one dose of vaccine or no dose at all, so after how many weeks is it advisable to take next dose of vaccine?
Usually what happens is, in my case, one of the patient, he had taken his first dose of vaccine. After, I think, after 10 days of taking the vaccine, he had a social gathering, he attended the gathering and he got infected. So in that case, that scenario I'm giving, it is after the 3 months, after, like, once they have been infected, it will be like something like a immunization done to them, like similar to the vaccine taken only. So they won't be given any vaccine for about up to 3 months. After 3 months, they will have to take the second dose.
Okay.
It can happen after the first dose or second dose.
Okay. Okay, ma'am. So, like, are there any medicines which are recommended to prevent us from getting COVID? Any general medicines?
There is no general medicines as such to prevent the disease, but you can boost your immune system by having healthy diet, exercising, doing mild exercises, having good balanced diet, and having some vitamins C rich food, zinc rich foods. And there are some Ayurvedic foods like Chyawanprash. Our Indian government is advising some Ayurvedic Ayush Ayush medicines like Chyawanprash. You can have it on a daily basis to increase your immune system. And taking a vitamin C rich diet is very helpful in order to prevent the disease.
Okay.
And of course, you have to follow all the standard protocol like sanitizing, masking. Better is you always wear a double mask.
That is the must condition now.
Yeah.
So, ma'am, like, if a person tested COVID positive, so when that person should be home quarantined and when he or she should be hospitalized?
Yeah, depending upon seeing the report, usually the government decide whether he can be home quarantined or he needs to be hospitalized. Okay, and that depends on, they take the so many parameters into consideration, and I do not want to confuse you with all those like CT cycle. They detect the genome, the gene at what level it is detected. They consider they come to a conclusion whether it is a mild case, moderate case, and severe case. And even a mild case can go into a moderate or severe case, and so that is why some things needs to be followed during the home isolation as well. Maintaining your temperature, having a pulse oximeter at home, and checking your oxygen saturation and temperature at regular intervals.
Okay, so we should check our temperature and the oxygen level regularly while we are home quarantined.
Pulse oximeter and your infrared thermometer. Usually, mild cases, the most common symptom in all the COVID positive, like what have been into COVID OPD. I've been doing COVID OPD from past 1.5 years, and most of the patients I've encountered, it is the most common symptom is myalgia, that is body ache they get, and followed by fever, loss of smell, loss of smell, and loss of taste is one other common symptom which I've noticed.
Right.
And other symptoms, as you all know, cough, cold, like similar to any common cold and flu-like symptoms, these COVID-like symptoms are also there.
Okay.
Classical is these: loss of smell, loss of taste, myalgia. All those are classical signs.
Okay, ma'am. So, ma'am, these days we are also like listening about steroids. Like, what are these steroids and when it is advisable to take them?
Steroids are given in severe cases, moderate to severe cases, when there is severe cough or difficulty breathing, in order to clear out the infections in the lungs.
Okay, so like we should not take it on our own, right? Like
it is not advisable to take on your own. Usually, in severe cases, it will be given at a hospital, at the hospital level.
Okay, ma'am. So also these days we are listening about a new disease called black fungus. Like, can you tell something about it?
Black fungus, or it's called mucormycosis, is a fungal disease, And usually nowadays it is encountered in the patients after coming out of the COVID infection, like post-COVID infections, we are encountering these that could be because of there is a lot of studies done on that. Some say it could be due to the steroids use. Some say it could be because of the lot of zinc which is used, because nowadays on over the counter we are getting some medicines like called as immune boosters, which has vitamin D3, vitamin C and zinc. So on an everyday basis, most of them are taking it. And that could be, now they are saying that it could be due to the increase in zinc levels as well. And it is due to the oxygen given and the the water which is used in which is used on as a humidifiers. The sterile water the water should be sterile in the oxygen saturation units. That's what they are saying. It's a new thing. So each day new articles are coming. But the disease is old. But it is, this predisposing factors could be diabetic patients, patients in ICU, patient with immune suppression drugs like HIV, AIDS patient. All these are predisposing factors. Like patient or asthmatic and having a lot of steroid therapy and going into COVID infection and coming out of it with oxygen. Usually they are observed in those kind of patients, like those on oxygen for quite a long time, steroids, all those are causing nephromy. Yeah.
Is there
And so
any preventive measures for it, or we can't predict it actually?
nowadays, that is what prevention is, like decreasing the steroids unnecessarily. The overusage of steroids should not be done. Overuse of antibiotics, overuse of antifungals should be avoided.
Okay. So, ma'am, any general advice that you would like to give to all of us?
As we were following from the beginning of the pandemic, we follow the same protocol, like as I told you, social distancing. Now it is advised to go for 6 feet of distance between two persons, and wearing your mask properly. Wear your mask properly on the nose, on the mouth. Some wear it just for the of wearing it.
Right.
Wear double mask. It's always better, and sanitizing your hand frequently. Now it is said that more than the contacts, more than you getting the disease from contact surfaces, it is through the air. Air is the aerosol, the droplet infection. Like if a patient with a COVID positive patient, if he's in an infective stage, and if he's in an infective state, if when he coughs, when he sneezes, when he talks, or when there is lot of aerosol, that is small, minute airborne it's like something in the air with the virus and water around. It is called as aerosol, and that which when taken in could cause, when taken in from an infected patient, can cause severe that is the time when you can get infected with COVID. So that's the reason we need to wear the mask properly, whether it be cloth mask. But efficacy why they say cloth mask 55% efficient, and there are different studies again on the mask as well. So N95 or triple layer mask will help. That is what we have been doing as doctors. We have been doing from the beginning of the pandemic. Yeah.
So following the protocols can only save us from this pandemic.
Please get yourself vaccinated when your term comes. Don't listen to people like saying, "Oh, vaccine is better, Covishield is not." So please don't believe with all that, because we are on Covishield and we are doing COVID duties. And
That's correct. And ma'am, we all salute you for all the work that you are doing on the front line. Thank you so much for taking out time from your busy schedule and helping us out. Thank you so much, ma'am.